I just wanted to share that I've had some really great courses that I've taught over the last number of weeks on trauma nursing, on pediatric resuscitation, on adult resuscitation, and I really enjoy being with my nursing colleagues, physicians, respiratory therapists, and also learning from them. And in these courses, it's really great because we also get to share stories with each other and learn how we can better take care of these critically ill patients that come into our care, whether that's in critical care, whether that's in emergency departments, wherever that might be. One thing that always comes up is, man, some of these stories are really hard. These experiences are really hard. Not only are they hard clinically to know what to do, but also emotionally, and just recognizing that, man, we're working with real people who have real lives, and sometimes their outcomes aren't that great. And this has led to so many conversations about, well, how do we take care of ourselves? We take care of these patients, but then, man, after we deal with that trauma, you got to be like, all right, on to the next person. And it's like, well, wait a second, should I be okay with everything that just happened? When do I take care of thinking through this and dealing with the emotional side of the fact that maybe someone just lost their life, right? These are heavy, heavy things that healthcare providers have to encounter on a daily basis. And one of the things I wanted to talk about with you is having strategies on how to be intentional to take care of yourself in order to prevent burnout. Working in critical care, working in emergency departments, it does take a toll on you. Working, as emergency responders, it does take a toll. And one of the tools that we can use is actually called debriefing. So after an incident, whether it's a resuscitation, whether it went good or bad as far as patient outcomes, we can debrief with each other. And a hot debrief happens right after the event. And it doesn't have to be complicated. Maybe you're like, oh man, I got to talk to my manager about implementing these things. I need some kind of tool. And you don't really. The hot debrief right after the incident can look as easy as, hey guys, we're all still in the room. Can we just step out maximum 5 minutes and you talk about what happened? The hot debrief is for checking in with each other. 5 minutes is not enough time to really look at the clinical aspects of what happened. Maybe what you could have done differently, how to improve. That can happen at something called a cold debrief. This might be a few hours, few days later, where you can look at, okay, what went really well clinically? What can we do different so that the next time we encounter this problem, we can improve our care of these patients. But the hot debrief, this is where we deal with the emotional side of what happened and give pause and just check in with each other and say, hey, I know that was your patient. Do you want to just take a couple minutes? I'll watch your patients for you. Do you want to go get a drink? Maybe sit down for a little bit, and just taking care of each other. And just checking in and even having that acknowledgement that, wow, something happened, can be protective psychologically against burnout. Debriefing also has the ability to create a greater team cohesion, communication with each other. So then when you go into these events together, like a resuscitation event, you actually have better communication because you've been able to connect as people and not just as colleagues, but as humans experiencing human suffering. Because we want to prevent secondary traumatic stress. Other things you may have heard of is like post-traumatic stress disorder, where we kind of have this cumulative psychological impact of all of these heavy things that we encounter, and if we don't have a way of intentionally dealing with them, it can cause your career to come to a very rapid halt. So I challenge you, you don't have to be the trauma team leader, you don't have to be the doctor, you don't have to be the manager. You can say, hey guys, can we take 5 minutes and just chat about this case? Can we just see how everybody's doing? Can we just acknowledge that that was really hard and see how everyone is doing? I challenge you, try doing a hot debrief, and in later videos, I hope to be able to describe to you some tools that you can use to debrief with the team. One such tool is called the Stop 5. There's another tool called Discern, and you can look those up if you want to implement them with your team or just have a resource that you can use. Those are better resources even for the cold debrief where you're looking at the clinical aspects of care, but just having a couple questions on hand like, how are you doing? Does anybody need to take a quick break? Can go a long way. All right. I hope that you have a good rest of your day and that you're taking care of yourself and your colleagues at work.